This video is in reference to the abundance of messages that I'm getting from people about sick chickens, typically baby chicks. Y'all are asking me about two things. You're asking me about coccidia and respiratory distress issues that are happening. A lot of y'all are bundling those things together and thinking that you're going to treat with cord and it's going to cover all those symptoms, and it's not. So this is part 2 of this video where we're going to talk about respiratory diseases in chickens. Part 1, we talked about coccidia, so go ahead and go back and watch that if you're interested. And then to get started, if you're just tuning in, we're plugging this book. Miss London over at London's Priorities has been plugging this book, and I'm going to hop on the train because this book is so beneficial to chicken keepers at any stage in the game. This book has helped me diagnose and treat so many illnesses, and like I'm always saying, don't just take my word for things. Here, what I'm saying is my experience, and then of course take your own experience, go do your own secondary research to make decisions that are going to be best for you and your flock. 'Tis the season, y'all. I just said it in that last video, but it's hot, it's muggy, there's mosquitoes out. Chickens in general have really sensitive respiratory tracts. They're really hardy until they're not. All it takes is some bacteria, some virus, some pathogen to come in, and all of a sudden certain chickens in your flock are showing these symptoms, and it's scary. I think for most chicken keepers, especially new chicken keepers, whenever there's any illness going on, our first thought is, oh shit, they have Merrick's or mycoplasma. And I have to tell you, I don't actually have any firsthand experience with either of those diseases, other than like the doom posts that I've seen on Facebook and throughout the internet. So I don't know what the deal is. I don't know if there are things that maybe some chickens have more built up natural immunities to than others. I also don't know why NPIP doesn't test for those things. But I have to assume that maybe throughout the evolution of chickens, maybe there are some chickens who have begun to build more natural immunities to these things, because I know a lot of breeders are breeding for health and vigor in our flock, and a lot of breeders do not vaccinate for these things. So I'm just going to cover respiratory illnesses in just a blanket, because there are a lot of them. Mycoplasma is not the only respiratory illness that chickens can get. If you look through this book, you'll see a bunch of them. Things like infectious bronchitis, creusa. Chickens have very sensitive respiratory tracts in general, so a lot of things can upset their respiratory tract, their eyes, their nose. Ear canker is a thing. Wet pox, fowl pox is a thing this time of year. And the thing to keep in mind is that a lot of these illnesses are either bacterial or viral. So just throwing like LA200 or Thailand 50 in there is not necessarily going to remedy the problem. It may remedy any secondary infections that they get while their immune system is compromised, while they're trying to fight off whatever viral thing is going on. But antibiotics are not necessarily the answer unless you know what you're treating is something that antibiotics are absolutely going to fix. You know what I mean? Like antibiotics won't cure a viral infection, only time will. So the thing to know about a lot of these illnesses, I do have experience with fowl pox, both wet and dry. Fowl pox, both wet and dry, is, I mean, it's not cool, but it's kind of cool because it's like chicken pox in humans, where chickens get it once and then they're done. Like they don't keep getting it, but it runs its course through the entire flock, and it's slow. A lot of these diseases are slow running in chicken. One chicken will get it, and then over the course of the next like 2 to 3 months, the whole flock is going to get it. My course of action in that scenario was to supplement immune systems, was to do things like oil of oregano, oil of garlic in the water, clean water, vitamins, electrolytes, make sure feeders and waters are clean, the coop is as clean as possible, to slow infection and to give the chickens the best chance possible for their immune system to fight off the virus. If you know that you have a sick chicken, it's a good idea to separate that chicken from the flock, again, to try and prevent infection. Respiratory distress is not a symptom of coccidia. A lot of you are messaging me and you're expressing respiratory symptoms and you're saying, I'm going to treat with cord, which, I mean, sure, maybe the chickens, especially if they're younger, may be dealing with coccidia as well. But really, the only thing that treats a lot of respiratory illnesses is time, immune system. A lot of chicken keepers will use things like Denagard and Tiagard in the water to help quiet the symptoms of respiratory illness. But it's important to try and identify exactly exactly what you're dealing with to know how to treat. And of course, if you have any like serious losses, we did have the uptick in avian influenza over the last couple of years. If you are experiencing like chronic back-to-back deaths, that may be something to have checked out. That may be a reason to do necropsy on chickens who have passed to try to identify what's happening in that flock.